So I'm a pediatric surgeon that works in the Children's Hospital, and I'm also a researcher here at the Institute. And the research we do at the Institute is lung development. We're interested in lung development, especially in relation to a disease where babies are born with a hole in the diaphragm, and because of that they have abnormal lung development. And we would like to learn how these lungs develop abnormal to try and change their course during development. So I think it's really important because babies with this disease, when they are born, although the surgery we have to do is a relatively simple procedure, although it's risky, they mainly struggle after the surgery. It's done from their abnormal lung development, so they have really problems with their breathing. And the neonatologists who take care of these babies after the surgery and around the surgery really have problems sometimes to keep these babies alive because of their abnormal breathing pattern. It's really important to investigate this because babies with this disease are born, and then even though the surgery we perform on these babies is relatively simple for them, the main problem is their abnormal lungs, and after the surgery they struggle a lot from their abnormal breathing patterns. And the neonatologists, who are the doctors who take care of these babies in the intensive care unit, really have a hard time dealing with their respiratory problems after they have the surgery. So the main goal for our research is to really understand why these lungs develop abnormal in utero, and also how we can maybe intervene before these babies are born. The ultimate goal for our research is to come up with a therapy where we can treat the babies before they're even born, to prevent all these respiratory problems from happening after birth. So far we've discovered that there's one microRNA, which is a small piece of genetic code that is dysregulated during the lung development in these babies. And if you consider genes as light switches that you can turn on and off, you can consider microRNAs as dimmer switches that add an additional level of regulation and a much more subtle level of regulation of gene expression. So, because the Institute offered me a really good opportunity to combine my work as a pediatric surgeon in the hospital with starting my own research program as a researcher here at the Institute. And for that I could combine my research with the clinical problems I deal with in the Children's Hospital. And the other thing was the Institute offers a really good opportunity for new researchers to facilitate their research by offering all these core facilities that they supply.